Ani Bojo. Welcome, everybody, to this month's installment of the Ontario NEIHR webinar series. My name is Shanti Aguilar Cardenas, and I'm the Ontario NEIHR coordinator at the Waakabanes Institute for Indigenous Health. And this month we have a very special webinar. It is our own Ontario NEIHR climate crisis team. So we're very thankful for everybody joining us this morning. Before we get started, I'll just go over a few housekeeping items. So just to let everybody know that this webinar is being recorded and will be posted to our YouTube channel. So the link to that will be shared a few days after. So feel free to share this with your network. And we will also have a feedback survey at the end of the webinar, and we really appreciate it if you can complete that for us as well. We also will be taking questions through the Q&A feature. The chat is not available, so please type your questions into the Q&A. And we also are not able to answer questions live, unfortunately, for security purposes. So with that, I will pass it over to Michael, who will do our spiritual opening.
Thank you. We have an amazing team that works very well collaboratively together, and I thought it would be a great idea for all of us to come here today and present all of the different parts that we each work on to make this project so amazing. And so we can start by doing some introductions. So I'll start. My name is Sabina Mirza. I am a postdoctoral fellow at the Waakabanes Institute for Indigenous Health. I've been a postdoc here for a couple of years, and I'm one of the leads on this climate crisis project alongside Michael Etsy and a lot of other people now. And I'll pass it to Michael to introduce himself.
Oh, big question, Sabina. You're so kind. Giving me a shout out like that. They look beautiful on you.
Thanks.
Um, Hi, everybody. My name is Michael Brown. I also work at Waakabanes. I'm the cultural and spiritual events coordinator there, research officer, and currently a PhD student at Dalalana School of Public Health, um, in the public health stream of social and behavioral health sciences. And I'm feeling really good today. And I will pass it to Mim.
Hi everyone, my name is Nimika or Mim. I'm a Bengali settler born and raised on William Street territory. I'm also a student at Dalalana. I'm doing a master's in Indigenous health. And so I've been working with this team on the climate crisis work for a little over a year now. And yeah, I'm really happy to be here. And I'll pass it to Ethan.
Thank you, Mim. Hi, everyone. My name is Ethan. I use he, they pronouns. I am of Ojibwe and Scottish ancestry, and I am a two-spirited individual born and raised in Treaty 13 territory. I currently work as a community research assistant at Waakabanes Institute for Indigenous Health, and I've been working with these lovely folks for quite a few months now, and yeah, just happy to be here. And I will pass it to Tiara.
Hi, everybody. My name is Tiara. I use she, her pronouns. I'm a Sri Lankan settler. I grew up on the Treaty 13 lands of the Mississaugas of the Credit First Nation. And similar, I'm also completing my Master's of Public Health and Indigenous Health. And yeah, I've been a research assistant at Waakabanes Institute for, yeah, a little bit over a year as well. So very grateful to be here. And thank you, Michael, for your opening. Always an amazing way to start. So yeah, I'll pass it on to Maddie.
Hi everyone. My name is Maddie. I use she, her pronouns. I'm a British, Irish, French, and German settler on this land. I grew up on the Haldeman Treaty Territory, uh, otherwise known as Kitchener-Waterloo, and I'm currently in my first year of my Master's of Public Health and Indigenous Health at Dalalana, and I'm also a research assistant on the Climate Crisis Project. I'm super happy to be here, and I'll pass it back over to Michael and Sabina to get us started.
Thank you so much to all our amazing RAs. We can't do this work without you, so thank you. I'm going to share my screen now. And it'll kind of be set up in a way where Michael and I set the context for sort of the first phase of the climate crisis project. And then we'll have Maddie, Mimica, Tiara, and Ethan take us into where we're going next. So The title of our work is Impacts of Climate Crisis on Indigenous Young Adults' Mental Health. This project was brought to us by an elder in the Northwest Territories named Francois Paulette, and everybody was super excited to work on this project, and they still are. And it's just been a really amazing journey. So I'll pass it to Michael for our next slide.
Thanks, Sabina. So to kick us off, one more time, we are all from Waakpanes Institute for Indigenous Health and the Ontario NEIHR, which stands for the Ontario Network Environments for Indigenous Health Research. And we are housed at the Dalalana School of Public Health at U of T. And again, as Sabina just mentioned, our project is in collaboration with the Northwest Territories with the Institute for Circumpolar Health Research. And so this project is really meant to be conducted in 2 sites. And so this project will only, or this presentation today will only focus on the Ontario site.
Thanks, Michael. I'm gonna move y'all to the side of my screen. So what are we about to do is kind of from the first few phases of the project. So how did this project begin? Why the climate crisis? What is the question? What is the approach? Who is this for? What are we trying to do? And how are we going to do it? Are some of the things that we're going to be discussing in this presentation. And so sort of like a little agenda or key takeaways, how we do what we do, preliminary findings, and then next steps. So, sorry, I'm just, you guys are all at the side of my screen, and so I'm just trying to move you. Okay, how did it begin? So just as I mentioned, there's an elder, Francois Paulette, from the Northwest Territories. He is to your left. And this theme was proposed by him. And what he wanted to do was he wanted to answer the question, how does the climate crisis impact Indigenous youth mental health? And so he wanted to, originally, the vision was to do the same project in the Northwest Territories that we would do here in Toronto and then sort of compare the results. But since we're only sharing the Ontario site stuff, we'll just keep it to what we've done here in Ontario. And so you'll just see a picture here of Elder Francois Paulette, Clayton Shirt, Luana Shirt was also part of the project, and Etsy Stewart. Who's our supervisor, and we call her our fearless leader. So we worked on a pilot project originally that actually engaged youth from 2 of our community partners, which is Two Spirits of the First Nations and Native Women's. And so what we did was we put together a play that would answer that original research question. And so there was actually a theater expert who went to the Northwest Territories named Lena Recollet, who went there and used that question as a prompt for young people to put together a play. And then the same thing was done here in Toronto and then presented at one of our conferences back in about 2022 fall. I'll let Michael take this over because he made this amazing chart that we have in one of our papers. So I'll let you take this one.
Thanks, Vita. So for this slide, really, we conducted a bit of a literature review to find out what the current discussions were academically about the impacts of the climate crisis on Indigenous youth mental health. And so I ended up making this chart to kind of bring all those pieces together from across all the different literature. And so what we find is that Indigenous youth are really at the crux of responsibility for saving the planet, saving us all from climate change, which is really, really unfair, if you ask me. And beyond that, you can see in the chart, right at the top, you can see that little circle says climate change. And then on either side, you have both the direct pathways of impact and the indirect pathways of impact. So the direct pathways of impact are things that come directly from those changes in weather patterns and temperatures and things like that. Things like death, injuries, land dispossession, flooding, destruction of property, all these things that really directly impact a person's life, versus the indirect pathways, which are more like things like witnessing the impacts, witnessing wildfires, dealing with the drawbacks of pollution in the water and different foods, financial distress, things like if there's a flood and your bridge in your community breaks down, now you can't get in and out of your community without some extra steps. So those were in that indirect category. And all of those things are kind of minimized by this curved line you see almost in the middle there. And that little dot in the middle says resilience, because we did find that it was not all doom and gloom in the literature, that Indigenous youth are very resilient. And I know that's kind of an emotionally charged discussion to have about the resiliency of Indigenous youth. But it's a very real thing and it does exist and they are very resilient and we need to acknowledge that. And so what we found was the ways that they're being resilient is they're seeking new ways to adapt of their own volition and they're also actively speaking out through protests and things like that. Um, these impacts still make it through that barrier and result in a lot of trauma, a lot of cultural loss, family disconnection, loss of land relations, things like that. And as you'll notice at the bottom there, the mental health and well-being of Indigenous youth is embedded, it's nested inside the individual and community well-being, because we know that when one of us suffers, we all suffer. And so if anybody in the community is going through it, the rest of the community can feel that and vice versa. So as much as there is a protective barrier there of resiliency, um, everybody else that's not Indigenous youth needs to come together and support that and reinforce that, so that not so many of those harmful effects make it through.
So our research question, as I had mentioned, is what are the mental health impacts of climate change for Indigenous youth and what services are needed to support youth? So this was the main question that was used in the pilot project and is a question that has been sort of the through line as we continue through. We do use Indigenous knowledges frameworks, and elders and youth who are Indigenous have been involved from its inception until now. And we really do want to ensure that we're using cultural teachings and cultural safety principles. So even now with consultations and things that we've done in scoping reviews, we want to keep in touch with all of the people that we've done consultations with so that they can be a part of every single process that we go through. In terms of who is this for and who do we partner with, one of our two most significant partnerships on this project have been with Two-Spirited People of the First Nations and Native Women's Centre of Toronto. We've also worked with Kids Help Phone, which we'll speak about in a few slides upcoming, that we had attended one of their forums and done a little bit of a talking circle and some survey work there.
So this brings us to the what are we trying to do part. We know what our research question is. We kind of know the background story and the context. So these are really our main objectives. The first one is to really find out what these successful solutions to this problem are. And really what we know it'll come down to is transforming that healthcare space, using these interventions that are based in these Indigenous knowledges that will hopefully help reduce these health inequities for our peoples. Another objective is to go directly to the youth who are the ones being impacted by all of this the most, to hear what their voices have to say, to hear their recommendations, and to reinforce those and bring those directly to the policy table. And then the third objective is to mobilize the research that we're doing, partly things like this webinar, and a few more activities as we'll see as we go on. But really that KT piece, that knowledge translation piece, so we can really take our manuscripts and turn them into direct benefits. And so how are we going to do this? Great question, Michael. So we're going to sample roughly 300 participants in a mixed methods design. And so our elders and our community partners have strongly suggested that we continue to use a two-eyed seeing approach, where we make sure that we're not ignoring Western methods and tools simply because they are Western in nature, that they can still be useful. And so to do that, in part, we included both surveys and a more traditional talking circle methodology for our data collection.
Okay, and sorry, I feel like some of the tenses we have to actually change as we move forward with the presentation, because instead of how are we going to do it, I think this part, because it's such a like a multi-layered and multi-phase project that I think this should say, how did we do it? Because me and Michael are kind of tracing all the steps of the project. So just to kind of clear that, we've done this part, but are going to do it again on a grander scale. But we'll
That's
talk
right.
about that in a bit. This is also kind of how did we already do it. So
It's true. So what did we do? How did we do it? We sampled roughly 200 Indigenous youth and social service providers through this survey, administered both online and in person. They have already been analyzed, so that is also a recent update. We also included 10 knowledge keepers in two different groups to hear what they had to say and include that in our analyses, plus 15 healthcare workers in different group interviews with both of our community partners. And so we decided that all of this together would give us a really comprehensive understanding of the situation.
So to keep everything transparent, we just wanted to give a few examples of questions that we did ask in a survey, and we're going to be using this survey. So there was a Indigenous youth who helped us create this survey, and also based off of talking circles that we did at Two Spirits and Native Women's and through Kids Help Phone, we were able to develop this survey. So these are just two of the questions we wanted to share. Just to kind of give everyone an idea of the types of questions that we asked. And so, thoughts on Mother Earth being on the land. What is your take on the following statements? Strongly agree, agree, no opinion, disagree, strongly disagree. And then, for example, like thoughts on the climate crisis. What's your take on the following statements? And so, I am not a quant person at all. I'm learning, but I will hand it over to Michael to explain some of this a little bit better. Through the analysis that we did.
Yeah, thanks, Sabina. So we're not going to show all of the results, just a few standouts to give people a sense of what we've been finding in our research. And so this is a bit of a Likert scale here, going from strongly agree to strongly disagree. And if you notice that there's a really high level of strongly agree and agree. And so these were really the top ones. And so people really did overall agree that land is important to their overall health, that when they're on the land, they do notice positive changes in their overall health, that when they go on the land, they do feel connected to Mother Earth, and that they do believe that the climate crisis is real, which might seem like a strange question to ask at first. But it tends to be a bit of a controversial topic, the climate change and climate crisis, or at least it has been. And so we wanted to include that just to kind of tease out that tension a bit and see if it's even a concern of people's. Because if it's not, then there's no, pivot. But they
Kind of
do.
a thing. I
So we
agree with
included.
you on that. I agree with you on that, Michael. That's kind of a thing when I tell people like the work that I do, they're like, but is the climate crisis even real?
Yeah, it's a very tense conversation to have sometimes.
Yeah.
Um, and so here we have some more of the standout findings. And so here we only included the combined um, numbers for anybody who either strongly agreed or agreed. We considered that all on the same side of that scale. And so when it comes to how often people feel anxious about the future of Mother Earth, 91.2% of people either strongly agreed or agreed. Um, and then as you can see, they're all really, really high. The lowest one that we've shown here is 78.4%, which is nearly 80%, and that's quite significant. And so again, so people are feeling that their spiritual well-being is very connected to the well-being of Mother Earth. Their spiritual connection exists between them and Mother Earth. All these things that might seem obvious and common knowledge and kind of a common understanding. In the Western system, especially in academia, we have to really clarify these things and provide evidence to back up these claims because they don't seem to make the same assumptions. So again, a lot of our participants do feel sad about the future for Mother Earth. They think about the climate crisis often. Their cultural identity is connected to the well-being of Mother Earth and the land, and that they do feel grief for the suffering of Mother Earth. So very, very strong connections, very strong relations.
We also did talking circles. And so we'll just highlight one of the ones that we did, which was there's a forum that's held by Kids Help Phone every year called the Weaving Threads Forum. And so we kind of opened it up rather than just asking youth about the impacts of the climate crisis on their mental health. We also decided to ask social service providers who work with Indigenous youth the same talking circle questions that we asked young people. And so these were the 4 questions we asked. Tell us how you understand the climate crisis. How did it develop? How has the climate crisis affected your mental wellness? What do you consider the most important thing about the climate crisis? That's kind of 2 questions in one. We slipped that in there. How do you see Indigenous youth mental health in the future? And what are some of your future hopes, fears, and solutions for Indigenous mental health? And then the 4th one, how do you see climate crisis in the future? What are some of your future hopes, fears, and solutions for climate crisis in terms of governmental policy locally and nationally?
So from all those talking circles, don't know if you noticed, but in that initial picture of the talking circle focus group section, there was a bit of an easel poster paper thing with a bunch of sticky notes on there. And so that's how the participants really gave us their perspectives or their experiences. And so we took all that, analyzed that thematically, and we came up with these 5 meta themes across all of our qualitative data collection stuff. And so that you can see here where environmental genocide came out, health was another thing, there was systemic changes, community solutions, and then a category for the future. And so, I mean, I won't read this whole thing, so I'll just give a few examples from a few different things. When it came to the feelings and emotions of health, for example, that one kind of stands out to me right now. There was 2 sides, and they seemed kind of controversial at the same time. The youth were feeling both hopeless and hopeful at the same time. There was a lot of hopelessness about, people were concerned about, sorry, even becoming an elder in the future. That if it, that seems like a scary thought to them. What's the point of this if the earth is going to be destroyed? Why would I have a good relationship with the earth? How would I continue to know these teachings? Why would I learn them if they're not going to be useful? Do I even want to have kids to bring into this broken world? A lot of those kinds of narratives. But at the same time, there was a strong sense of hope that if we do something now, if we start now, if adults, if you will, kind of got our stuff together and helped out the youth, the next generation fix the problems, that they could actually be fixed and we can actually achieve health and wellness for the next 7 generations. That one really stood out. Another one that stood out was the systemic challenges meta theme, kind of in completion. A lot of capitalism comments about how capitalism and greed are kind of at the forefront of uh, the progress of the climate crisis and climate change, including things like resource development, mining, deforestation, all those different things. But then the systemic barriers of, that come with capitalism and colonialism, things and corporations and industry and all those money-making ventures. The youth are not blind. They're not ignorant. They're not naive they can very well see that these things are getting in the way of any kind of climate solutions. Um, and then just one more thing about the community solutions meta theme is that they brought out both not just their own values and their own solutions and their own action items, which are directly useful to inform policy, but also things that individuals can do on their own and things that we need to do as a community, as a group and a collective. And so that was really, really cool to see. Even just as a human being, as a person, not even as a researcher, but as a person to see some of the things that I can change in my own routines to help out, like today.
Thanks, Michael. I also love how you put everything together in this beautiful chart. It's just, it's really easy to follow along. So one of the things that came out from the surveys and the talking circles was from youth that we need to do better. We need to respect and value Indigenous youth voices and respect and value Indigenous land. And how do we achieve that? Well, we need a future that values indigeneity, culture, connection to land, traditions, and relationships. And we need to have a future with more on the land programming and services based in Indigenous knowledges, which is kind of where we're going next with this project. working with our community partners to potentially have some more land-based programming that can be run by some of the people who are working on this research project. And so one of the things that came out a lot is that we need action now. The way that the first part of the project was funded was through a Catalyst grant. And the way that the second part of the project is funded is through a project grant that Etsy and I applied for last year, and we were successful. And so we're able to continue forward with this work, which we're really excited about. And so now I'm going to pass it over to our research assistants who are working on what is to come next for this research.
Awesome. Thank you, Sabina and Michael, for setting that up for us. So building, of course, off of our previous literature review, our review and like our previous findings, it's very clear that climate change is already affecting the mental health and overall well-being of Indigenous youth across Turtle Island. But right now, our assessments tend to be, more regional and project specific. What we don't have is a national tool, which is something that measures these mental health impacts in a way that's Indigenous led, youth centered, and also based in strengths of FNMI ways of knowing, being, and doing. So that's kind of like the next phase of our project where we see the need for a national assessment. And we want that to basically inform programs, resources, policies, and action meaningfully. For us, this really isn't just about measuring impacts, it's about supporting Indigenous youth leadership and really guiding systems to respond in culturally safe ways. And that's kind of what leads to, again, like our second phase and our second question that then asks what mental health impact assessments, tools, evaluations, or frameworks already exist for or by Indigenous youth, especially those that speak to climate-related impacts. So this is essentially the question that we're going to conduct a scoping review on. And this is essentially going to help us understand the landscape, as well as if there's already a tool that already exists to help inform our proposed tool. So I'll go to the next slide.
Thanks, Tiara. With that question in mind from the previous slide, we consulted 3 knowledge keepers, Dr. Carol Hopkins, who is the executive director of the Thunderbird Partnership Foundation, who is of the Lenape Nation, Kimberly Fairman, who was the executive director at the for Circumpolar Health Research, and Luana Shirt, an Indigenous knowledge holder and a Plains Cree woman. The questions we asked the knowledge keepers were, what resources currently exist to support the wellness of Indigenous youth? What can you share about your personal past and history about climate? How do you see the climate crisis impacting youth, mental, physical, emotional, and spiritual health, both presently and with anticipated impacts? What can we do to move forward in a good way for the next 7 generations? How can we uplift and nourish youth going forward? What do you think the outcome of this impact tool will be to ensure community benefit and action? How do you think the climate crisis will impact the futures and perspectives towards the future of Indigenous youth? And then just the next slide. Through guidance from Luana Shirt, we came up with the guiding questions from the previous slide, which help us guide our consultations with the future knowledge keepers. Dr. Carol Hopkins provided us with an understanding that the focus of climate action needs to be viewed through the lens of relationality, in an effort to foster hope, belonging, meaning, and purpose among FNMI youth. This will allow for a shift to uplift and nourish Indigenous youth, and we also gain valuable insight into the process of co-developing the assessment tool itself with Indigenous youth. Further insights were gained on the potential impact of the assessment tool, including how culture and relationships with land and Mother Earth work to facilitate a balance of mental, emotional, spiritual, and physical health. Our consultation with Kimberly Fairman guided us in reframing the narrative of the climate crisis and the involvement of Indigenous peoples, particularly youths. The narrative in which we speak about climate change must be redefined to center FNMI youth in a self-determined manner. Modern approaches require curiosity and adaptability rather than fear. Further, indigeneity is not the only facet that may be important to youth regarding this topic and their well-being. Indigenous peoples and youth alone should not be carrying this burden of stewardship or be expected to become the experts regarding the climate crisis. This means youth need the space and freedom to exist and define their own approaches to culture, to wellness, to the land, and to the climate crisis. Indigenous leadership is still needed and beneficial, but a shift is required to provide opportunities for youth to define what that role is for themselves, without romanticizing of their indigeneity and relationships to the land or isolation of responsibility onto younger generations. With all that in mind, I will now pass it over to Mimika.
Thanks, Ethan. So in terms of the scope and review protocol we used, our consultations with the knowledge users actually also informed a search of gray literature. And so we include the work of some key organizations such as Thunderbird, the Yellowhead Institute, and Indigenous Climate Action, for example. And we also search other gray literature like community reports, toolkits, policy briefs, evaluation frameworks, those kind of things. And those were identified through a Google custom search. And these consultations also helped us to focus on what our scope actually is and identify appropriate search terms used to identify some peer-reviewed literature as well. And like overall, we kind of just adapted the typical Western scoping review protocol, which is by Arksy and O'Malley. And we tried to weave in Indigenous research methods and like key foundations like relationality, collaboration, partnership, reciprocity, and community benefit. And so this also included selecting studies with the consultation of knowledge users, charting some available data, and we'll also be sharing a summary of the results with the knowledge users, as Sabina said, to bring them back within the process.
Awesome. Thanks, Mim. So yeah, just building a bit off of that, we just wanted to talk a little bit about the strengths and limitations of scoping reviews. So for this project, of course, we use the scoping review to understand what actually and currently exists in the literature at this point. Scoping reviews are helpful because they identify patterns across studies and they highlight knowledge gaps. We're also able to see whether any tools or frameworks really align with what we're hoping to create. And so scoping reviews are helpful in kind of giving us more of that broad and comprehensive picture. But again, as Mim had mentioned just a little bit, it's also important to acknowledge the limitations. So again, scoping reviews follow a pretty rigid step-by-step Western methodology, and they're not an Indigenous method of reviewing knowledge. They don't naturally incorporate Indigenous worldviews, relational approaches, or community-led ways of knowing. And because of that, this method may miss really important work, things like student projects, grassroots initiatives, ceremony-based knowledge, or tools developed locally by and for Indigenous youth. So while scoping reviews are useful for understanding the academic landscape, we do know that it's only one part of one part of the story. So that's why, as discussed before, our consultations with community keeper or knowledge keepers, as well as our next steps for this project are integral to making meaning of this project. And I'll pass it on to Maddie now to talk about our next steps.
Perfect. Thanks, T. So now that you've heard about why we began this work and what we've learned so far, I'll walk us through what comes next as we move into the next phase of this project. So for the scoping review, we're now wrapping this up, and this marks an exciting shift from gathering information to putting that knowledge into action. As we talked about, the scoping review confirms something important, that there's currently no existing tool that meaningfully measures the mental health impacts of the climate crisis on Indigenous youth nationally across Turtle Island. This is a key validation piece. It confirms that the National Impact Assessment isn't just helpful, it's needed. So with that confirmation, we need to build this tool. So the National Impact Assessment will be shaped by successful components identified in the scoping review, consultations with knowledge keepers, feedback from insights from youth, talking circles, and then pieces of the original survey. We're weaving together the most meaningful and relevant elements to build something that actually reflects Indigenous youth realities. Once the tool is drafted, we'll be piloting it so we can refine it with direct input from youth and community before distributing it nationally. This helps ensure the assessment reflects community realities, lived experience, and strengths. Alongside this, we're moving forward with key knowledge mobilization pieces. We have a mixed methods paper currently in press. We're also developing a methodology paper that highlights specific examples of the Indigenous knowledges framework in action throughout this project. This contributes to the growing body of research regarding culturally ethical research by, with, and for Indigenous peoples in the Turtle Island context. We also worked on 2 different documents outlining the project. So there's a community newsletter that discusses the entire project in detail till now, as well as a policy brief, which provides a more condensed overview to inform policymakers. And we're in the final stages of the graphic novel that shares early findings in a youth-friendly and accessible way. This next phase is about putting knowledge into action, supporting communities, informing services, and helping Indigenous youth identify what they need as the climate crisis continues to shape mental health and well-being. So to end off our presentation in a good way, I'll pass it back over to Ethan, who's one of the writers on the graphic novel, to share a sneak peek.
Sorry. Thank you so much, Maddie. So with guidance from Luana Shirt and Sue Lemure, we came up with a culturally sound narrative to translate our data from Indigenous youth into a story that made sense. There are many storyboarding sessions, and despite our best efforts to make it a smooth process, we struggled a little bit to keep the youth engaged despite incentivization. The whole process took around 10 months from initial data from phase one to storyboarding and to putting pen to paper and coming up with graphics and characters. The final draft shows the diversity of Indigenous youth through the character designs and their stories. It was integral from the team to represent every walk of Indigenous life and to ensure that our most marginalized communities were represented, such as 2S and Indigenous queer youth. The final draft is something that we feel translates the data into a tangible and accessible way for Indigenous youth to understand what is being presented to them, as well as a way for them to connect with the source material. We are so excited to share this graphic novel sneak peek with you, and we hope you enjoy the final product when it comes in the new year. And with that, I'll pass it back to Michael and Sabina.
Sorry, I wasn't able to unmute there. I love that graphic novel sneak peek. It's so good. I know when you have a copy, it took myself, Ethan, and Michael, we were like, we'll get this done in half an hour. And then it ended up taking 3 hours in the boardroom to put together that sneak peek. But it's also really fun and just like such a creative way to disseminate knowledge and to translate knowledge. So I love it. And I'm really excited to see the final product for that. I guess at this point, we would just ask anyone if they have comments or questions. There's a Q&A at the bottom. And I do think there's one comment. Oh, there's just one comment. I'm sorry I have to leave. I just wanted to say the work you are doing is amazing. I wish I could stay to the end of the discussion. So we appreciate that. But yeah, the person had to leave. But if you do have any comments or questions, do you want to put them in the chat? Oh, thanks, Elizabeth. I didn't even see you there. Elizabeth is one of our previous RAs. Such important and impactful work. Great job, Ontario NEIHR team. Thank you so much, Elizabeth, for attending and for your comment. I'm just seeing if there's any others. I don't think anyone can actually like unmute or speak or anything, so you'd have to drop your question in the chat. Is there anything else that anyone from the team wanted to share at all that we might have missed or that you just, have on your mind that you want to share? Oh, Rod, hi. Rod McCormick asks, has the impact assessment tool been developed? And so at this time, I will let the scoping review team answer if you'd like.
I can go ahead. And Mim, anybody, Ethan, Maddie, please jump in. But yes, we are currently in the process of completing the scoping review. And then so based off of that scoping review, we're essentially going to take the survey that we have and, have more consultations with knowledge keepers and have our talking circles with Indigenous youth to really get feedback and kind of like adapt the tool that we already have. So we don't have it yet, but it's coming. So stay tuned.
Thank you so much, Rod. And Rod is also a big part of this work and is going to help us with the next phase of this like land-based stuff and whatever. So we're really appreciative, Rod, that you came to our presentation and that you're going to be a part of this process as well. Sorry, I should say Dr. McCormick, but I've met Rod a million times, so that's why I said Rod. Thank you so much.
Yeah, if I may jump in, just while other people may be thinking of questions or whatever, but I do want to share that something that really jumps out to me in this work is the strength of Indigenous youth and the willingness to to figure out how to do better, to figure out how to rebalance our relationship with Mother Earth. And like it's not like we came on the scene and noticed they need help. They've reached out. They're actively reaching out. They're saying, we're gonna do this with or without you, and it would be much easier with you. So please jump on board is really the message that I've personally heard. And I live for that, honestly. I live for that let's try to figure this out attitude. If I'm gonna support anything, it's gonna be that, you know? That's my little 2 cents.
Yeah, no, Michael, I'm glad that you raised that point because I noticed at the talking circles that we did as well, just having an elder there to even just support the way that people were feeling and some of the anxiety and grief was really important. And so I appreciate that point because I feel like even if we discussed difficult or challenging things, having everyone together and having the elder there did make some of those talking circles a little bit more hopeful to walk away from, even though the things that we were discussing were challenging. I think we have another question. So thank you, David, for your question. When you reference youth, what age group is included? How many youth are in this cohort? So I think originally when we did the first phase of the project, I think we did say 13 to 29, but as a result of some of our community partner organizations extending their definition of youth to potentially into their 30s, we also just expanded our definition of youth as well. And so I'm pretty sure we kind of go into like a 35 age range. And the majority of the youth were, I think, from like 18 to 35 for the first phase. I don't think we've decided exactly what age range we're going to work with for the next phase of it. Um, I'm not sure if the scoping review team has any answer for that. And sorry, you also had how many youth are in this cohort? There was approximately 200 that we surveyed and were part of talking circles for the first phase. For the second phase, I think it's kind of undecided at the moment.
I will say for the scoping review, we looked at youth from, I believe, 16 to 29, just to see what exists for those that age group out there. But I think, yeah, when it comes to it, testing the tool and using the tool, we'll see who's like open to it and who the community partners bring in.
Thanks, Mim. Thanks, David, for your question. Okay, well, if there are no other questions or comments, we can also end. And I would love it, Michael, if you could do a closing for us, just to also just close off in a good way. Thank you, everyone, for joining our webinar. We're really happy to present together and just show you our collaborative efforts. And I'll pass it over to Michael now.